I am welcoming you, my friends. I'm so excited for today's webinar. We've been really wanting to learn about the topic of improving lymphatic health for folks with Waldenstrom's for a while now. And just in case you don't know who I am, my name is Ann McMullen. I'm the IWMF's Wellness Program Coordinator and the Community Yoga Therapist. I want to introduce you to our wonderful guest in a moment, but for now, just a little bit of housekeeping. So just a reminder to stay muted unless we invite you to unmute during the question and answer period. If you have questions, in the moment when the question arises, just type it into the chat so we don't forget about it, and we'll circle back to it at the end. And for that question and answer period, you can funnel your questions through me if you don't want to be on camera. That's recorded for the folks who can't make the live session. And just a reminder that the complementary integrative practices that are shared in this webinar are to be used in conjunction with standard medical treatment along with the approval of your doctor. Just a heads up as well, we're going to be doing a gentle chair lymph flow yoga sequence. That's for the whole body. And this will include some self-manual lymph drainage. So just another little disclaimer right up at the top, manual lymph drainage is contraindicated for those with acute cardiac conditions or those managing an acute infection. So we strongly suggest that if you have any reservations about doing the movement portion of this class, you can skip it, you can check with your doctor and come back to the recording later. Or if you have any questions about whether specific movements are right for you, you can reach out to me on an individual basis. And I'm just so excited to learn from our speaker today. So it's my pleasure to introduce a kindred spirit, and I think you're going to start to understand why we're kindred spirits when you get to know her a little bit better. She's an incredible resource, Barbara Jackson Tobin, who goes by the name of Babz. She is an occupational therapist, a lymphedema therapist, and while lymphedema is not something that is a common symptom of Waldenstrom's, many of you experience secondary cancers that might have that as a symptom, or you might have had lymphedema. So she's also a certified yoga teacher, yay, and a Reiki master. She's trained in oncology yoga, and she's the founder of Lymph Flow Yoga, which is a type of yoga specifically designed to improve lymphatic health. And I can't wait for that part. Babz works in outpatient occupational therapy at Massachusetts General Hospital. And she frequently collaborates with cancer care professionals at Dana-Farber Cancer Center on the topic of lymphatic health. And that's how we found her, was through a recommendation of somebody at Dana-Farber. Her mom, who is a breast cancer survivor, who manages lymphedema, is Babz's ongoing inspiration. And I can really relate to that, Babz. At the close of our webinar, I'm going to point you towards all of Babz's information and resources so that we have that. And she has gone out of her way to learn more about Waldenstrom's for this webinar. So of course, I'm curious. I'm just going to throw this question to you, Babz. Why did you say yes to our Waldenstrom's webinar today? What about this, was interesting to you?
Hi, everyone. Thank you so much for the introduction. And I really want to come to meet you all. And I've learned so much about this condition and about lymphoma. And I really want to provide you with another tool. So I know you have this group, and it's so wonderful that we can all come together virtually. I think that's one of the good things that came out of the pandemic, maybe the only thing that we can actually connect virtually. But really, I just want to share my practices with you and give you and provide you another tool to help you have more control in your own care and your treatment and your life. So that's really my hope, is just to help you feel better ultimately.
Thank you so much, Babz. And just quickly, how is your mom doing?
She's wonderful. I'm on her though. I'm on top of her all the time, helping her to continue to do yoga with me and keep up with all her lymphatic health practices. But she's wonderful. She's, like you said, my inspiration. And yeah, I teach a class every Thursday morning. She was there this morning. So she's really doing wonderful, and I'm so lucky to have her.
Awesome. Thank you. Well, I will turn it over to you, Babz, and be here if you need anything.
Awesome. I'm gonna go ahead and share my screen. Did it pop up for everyone? Okay, very good. So, welcome. I'm really, really excited just to share this presentation. The first part of this class will be a PowerPoint presentation. I'm going to guide you through a lot of information. But during this time, feel free to sip water, sip your tea or coffee, and move around in your chair a little bit. And then second half of the presentation, we'll actually do a lymph flow yoga chair practice, and then we'll save some time for questions and to get to know one another a little bit more. So, welcome. So, again, a little bit about me. My inspiration is my mom, and during the pandemic, all of the outpatient clinics shut down. So I really needed a way to connect with my patients, connect with my mom. So that's when I started teaching this type of yoga that I created called lymph flow yoga. And it's basically a specific type of practice to encourage lymph flow in the body. So it was born in 2020, and I started teaching a free class every week. And then I started to build a YouTube channel and then online community. And it's kind of grown and grown, similar to it sounds like what this program has become. And it's a really a big community that I'm so lucky to be a part of. So, just a disclaimer that I always say is that although I am an occupational therapist, I'm not your specific occupational therapist. So this presentation is intended to inform but not provide medical advice. And I saw a question in the chat, what is occupational therapy? So I'll answer that really quick. But I know many of you have heard of physical therapy before. It's very similar to physical therapy, but occupational therapy focuses on improving mental and physical health through daily occupations. So we basically figure out what is being disrupted. Is it sleep? Is it activities of daily living? Is it dressing? Is it bathing? And then we figure out goals to improve and to help you to improve your quality of life. So OT is, I kind of describe it as kind of like psychology and physical therapy put together. Our roots are in mental health. So it's kind of like helping the mind and the body is a simple way to say it, but very similar to a physical therapist. And I always like to say, listen to the whispers so you don't have to hear the screams. And this goes for this class or really any class at all. So those little voices in your head of, "Ooh, that's too much," or maybe that might not be right. Listen to that, because the more you listen to those whispers, then you don't have to hear the screams and the pain. So I think it's a good motto to kind of live by in general as well. So today we're going to dive into lymphatic system anatomy and physiology. This is something I could probably talk about for 10 hours, but I won't bore you with that. I will keep it simple and digestible. And then we're going to talk about the four different components of this type of yoga. It's a specific type of yoga. We'll talk about the benefits. And then I found three research articles about lymphoma and exercise, two that have to do with yoga and lymphoma, and then we'll engage in a chair practice like I mentioned, and then we'll have time for a Q&A. So first, I'm just going to hide my little um, control. There we go. So I have more room. So we're first going to talk about lymphatic system anatomy and physiology. So you may or may not have heard of the lymphatic system before, but essentially it's one of the systems in the body. So you all know about your cardiovascular system, your nervous system. You have all these major systems in the body. So the lymphatic system is one of these systems, but it's super, super important. It develops around week 5 during pregnancy. And in touch with every corner of your body, including your brain, which is called the lymphatic system. And I like to share with my patients or my participants that if we didn't have a lymphatic system, we would look like balloon animals. So the fluid would just build and build and build and build and build, and it would never be filtered out and moved. So we would just be filled and filled with fluid. It has a vital role in our cardiovascular health, our immune health, and our digestive health. And we'll get into that a little bit too. But it is essentially a network of organs and vessels that transport this fluid throughout lymph nodes and then return that fluid back into the bloodstream. And I have many pictures that will help to understand this as we go. But you can see this picture right here. All these green little squiggly lines are the lymphatic system. So they're little rivers throughout your entire body that transport fluid throughout your body and your mind. So there's many different components of the lymphatic system. You have lymph vessels. These are the little rivers that are running along your arms, your neck, all throughout. These are what carry the lymph fluid and transport the fluid. You have lymph nodes, which in your entire body you have around 700 or so lymph nodes. And these are like the security guards. The lymph nodes, I'm sure you all are familiar with where lymph nodes are, or maybe you're not, but oftentimes doctors will kind of feel around and maybe see if there's some swollen lymph nodes. So the lymph nodes are basically like the security guards. They're the ones who stop everything and say, okay, is this fluid okay? What's going on in the fluid? Do we need to send signals to fight this fluid or send signals somewhere in the body? So think of the lymph nodes as security, and they're the ones who are going to filter and kind of keep track of what's going on in the body. They also are the area that store the white blood cells, the B and T cells. The lymph fluid, that's the fluid that's kind of draining through our body, that's moving all the time. It's made up of about 5 different components. In that fluid, there's protein, there's water, there's different cells, there's different waste products and fat. And then also part of the lymphatic system is your thymus gland, the bone marrow, tonsils, spleen, and Peyer's patches, which is a type of immune response in the digestive tract. But that's just a quick overview. And don't worry if you're like, what is she saying? It will be simplified throughout, and I'll keep giving kind of, we'll re-engage and re-talk about all of these things. But keep this kind of image in your mind of this system. And if we didn't have a lymphatic system, within 24 hours, we would pass away, we would die. So it's a really critical system that I think deserves a lot of health, especially when you've been diagnosed with lymphoma, which is impacting lymphatic system directly. So there's 3 major functions of the lymphatic system. One is fluid balance. So think of that balloon animal again. If we didn't have the lymphatic system, the fluid would just build and build and build and build. So we really need the system to help to filter, to move the fluid, to get rid of the fluid. It has a major role in digestive support. There's larger protein molecules throughout the digestive tract that can't go through the bloodstream. They need to go through the lymphatic vessels first before they go back to the bloodstream. So the lymphatics has a really important role on reducing inflammation in the gut area and in the abdominal region. So if you're ever feeling kind of heaviness or bloating or stuckness in the belly or in the digestive tract, doing some of this lymph drainage that I'm going to teach you and doing some of the yoga poses and movements will help to move that fluid a little bit quicker and improve this bloating or stuckness that you're feeling. And that goes for any part of the body too. So you might feel some days that your legs might be really heavy or filled with fluid. Doing some of these practices that I'll teach you will help to move that fluid out. And lastly, and probably most important for all of you, the lymphatic system has a major role in immune response. So, because of those lymph nodes having to be that security guard, they're the ones who are going to say, okay, this fluid is good. Let's bring it back to the bloodstream, or this fluid, something's off, something's not right. And then the body's going to respond. So, if we improve our lymphatic health, improve the fluid movement, then we get the individuals going through the security line move a lot quicker. So I know that a lot of my patients have asked me, is this safe to do if I have cancer or lymphoma or any type of diagnosis? And it is, because the fluid is naturally moving at a very slow pace through the body. When we do our manual lymph drainage, when we do our yoga poses, and when we do these practices, it helps just to move that fluid quicker. So if you think of, you go to the airport and you have the long, long security line, we're all going to get through the line, but it could take an hour. Or if we help the body, it could take 10 minutes. So it just helps to move that line quicker. And that's also helpful because, say, someone had a peanut butter jar or a toothpaste in their bag, the security guard is going to detect that a lot quicker if the line's moving a lot quicker. So hopefully that kind of helps you as we think about how this can be applicable to you. I always like to stop and kind of think big picture, because I can kind of nerd out on these things, but I think I want to put this in here just to take a step back and kind of show you basically like where is this fluid coming from? So you, like I said, this lymph fluid is moving all throughout the body. So you have your circulatory system, which is your cardiovascular system, your veins and your arteries. And then running right along that, you have the lymphatic system. So if you think of like a train station and you have three different lines, you have the blue, the red, and the green line. They're all moving out and then coming back to the heart. So basically what happens is if you look here over on the right, the arteries are what brings the blood away from the heart. I always think of a artery away. So the heart pumps the blood, the arteries move that fluid away from the heart. And what happens is some of the fluid from those arteries gets dumped out into something called our interstitial space. And that's basically like this kind of empty space between our skin and our muscles. And it's also in between our organs. It's just this kind of lingering kind of jelly space. So the heart is pumping the blood. The arteries are bringing that fluid, the blood all throughout the body. Some of that fluid gets kind of left behind. I like to think of this like if you had a waitress carrying like a tray of, we'll say martinis, say she had 10 martinis and she was going to her customers, and then she tripped a little and three of those martinis fell on the ground. um it's kind of the arteries are almost like a little bit of a sloppy waitress. So she drops three, those three martinis that just fell on the ground. Now the busboy has to come in and pick them up. We can think of the lymphatic system like the busboy. So the lymphatic system goes, oh, she dropped the martinis again. I got to pick up that fluid. So that's this green right here in the center. That's the busboy going, oh, got to pick up that fluid. The waitress is sloppy again. I got to pick up her slack. So the busboy takes on that fluid and then he goes, well, it spilled all over the ground. So I guess I got to go clean it up. He brings it back to the kitchen. Well, imagine the kitchen are the lymph nodes. So the busboy is bringing that fluid, got to go get it filtered back into the kitchen to get filtered by the lymph nodes. And then the busboy is like, all right, well, I cleaned up the fluid. Now we can bring it back to the waitress. And so the lymphatic system, the busboy brings it back to the veins, and then the veins carry that fluid back into the heart. So hopefully that kind of helped you give a little bit of an analogy of what's going on. So here's another image that I really like. You can see that the cardiovascular system here on the right directly mirrors the lymphatic system on the left. So wherever there is blood vessels, there are lymph vessels. So wherever there's a sloppy waitress, there has to be a busboy, right? Because if not, then we would just have water and dishes all over the ground. So, and that's kind of what can happen if the busboy gets burnt out. So say the busboy works really hard one day and he's like, oh, I can't do this. I too much work. And he forgets to take two out of those three glasses back. It's the fluid starts to build up. And that's what can happen in our body. So through these practices today, we're essentially giving the busboy a little tap on the back and a little bit of encouragement and help to move that fluid out. Okay, good. So let's talk a little bit about lymph nodes. So these are, again, that kind of security guard. They're the point of contact in the body that's going to say, okay, yes, no, what's going on? So again, there's around 600 and 700 in the human body. A majority is in our abdominal region. So you can see here in the center, this is where our hips, all of our internal organs lie kind of right in the center portion. So there's a ton of lymph nodes there. There's also many, many, many in the head and the neck region. There's, and then if you think about everywhere that there's joints in the body, so the shoulders, the elbows, the knees, the hips, the collarbone, the sternum, the spine, everywhere that there's joints, there's typically lymph nodes around that area. The lymph nodes can either be like a cluster of grapes, or they can be on a long line like Brussels sprouts on a vine. I need to find a better analogy for that one, but if you think of like the original Brussels sprouts, not the one in a bag, but like on a line, they can come down the neck. But this is kind of the main area. So the largest cluster is in the abdominal, second largest area is the neck and the chest. And something to note is if you have a secondary cancer of breast cancer or of some other type of cancer that lymph nodes were removed, then that's good to know because lymph nodes themselves do not regenerate. So if you've had surgery for something else or trauma to an area that you've had an incision and they maybe took some lymph nodes, those lymph nodes do not ever regenerate, but the pathways that move the fluid do. So say you may, and I'm just using this as an example, but it can be applied to multiple different cancers, but say you had breast cancer and a lymph node or two were removed in the armpit, that fluid coming from the arm to go into the armpit, that fluid and those vessels are not going to go to that lymph node anymore because it's gone, but they will go to another lymph node. So that also is helpful if I saw a couple of you have lymphedema, and that could have been caused by lymph node removal or disruption of the lymphatic system. So here's the lymph roadmap. So here is basically another image showing the pathway. So from the lower half of the body, the fluid comes up through the legs and goes through this major channel here called the thoracic duct, and then comes back into the circulatory system via this venous angle. So basically, all that fluid comes from the distal extremities, the fingers, the legs, comes up through the body, gets filtered by the lymph nodes, the security guards, and then comes back into the bloodstream via ducts behind the clavicles. If the fluid is filtered and we don't need it anymore, then we pee it out. So I wouldn't be surprised after this practice, especially yoga, you might have to run to the bathroom, but that's okay. It's a good thing. Walk to the bathroom, go safe, and that's a good thing because you move the fluid. So this is just a quick diagram of that I created that shows the many, many, many different ways to improve lymphatic health. So I just put this in here to show you that there's a ton of tools for you. We're specifically just going to talk about lymph flow yoga today, but there's so many ways that you can improve that security line movement. And I hope that this kind of gives you, yeah, a little bit of hope or direction of the many ways that you can help yourself. And I can give this to Anne afterwards to provide to all of you too. So this is my mom. She is a breast cancer survivor and unfortunately got lymphedema in her left upper extremity. Developed it about a year or so after her treatments. And I put this in here again to show you that there's so many ways to improve lymph health and to improve the flow of the body. And again, if we can improve lymphatic health, we're improving our immune health, we're improving our cardiovascular health, and we're improving our digestive health. So it really trickles out into all the other systems of the body. But these are some of the ways that she currently manages and that I help her to do. But we're going to specifically talk about lymph flow yoga. So, again, like I said, this type of yoga was born in 2020 from my knowledge of the lymphatic system and yoga and occupational therapy. I kind of just merged it all together and created this type of yoga. So basically, it's a mindful movement practice to encourage lymphatic health. And like Anne mentioned before, if you have any restrictions from surgery that you weren't able to move the arms, the shoulders, the legs, then you wouldn't want to engage in this practice afterwards. Or if you were in acute heart failure or an acute infection, acute meaning it's happening right now, that something is going on, that you need medical care, you'd want to get medical care and skip this yoga. And like we said, you can always come back to it and watch the recordings if you have any hesitation at all. But in each class, there's 4 different components. We do yoga poses, we do mindfulness exercises, breathing techniques, and manual lymph drainage. So these are the 4 major core kind of pillars of our practice. So first is diaphragmatic breathing. So we'll do this together. So I'll have you just find a comfortable seat. You can place your feet onto the ground and place your hands into your lap. And then just relax your shoulders. You can close your eyes if that feels okay, or you can just look down. And then we'll slowly take a breath in through the nose. And then exhale, slowly blow the air out through the mouth. Notice as you inhale where you feel the movement happening in the body. And when you blow out, notice where you feel the breath moving. Before I started practicing yoga at all, I remember the first one of the first yoga classes I went to. The teacher after class came up to me and she was like, it was a type of style of yoga that's very abrupt and very like regimented. And she came up to me and she was like, "You don't breathe right." And I was like, "I what? Like, what do you mean?" And she was like, "When you're breathing, you're going like this." I was sucking everything in, and the year after year of teaching, I've noticed that that is common, so that's why I want to see where you, in general, felt the breath happening. So if you're breathing when you go to inhale, if everything comes up, you're using your secondary respiratory muscles. So that's like your neck and your collarbone, all these areas where we really want to use our primary breathing muscles, which is our diaphragm and our intercostal muscles. So, diaphragmatic breathing is essentially belly breathing. It's a type of breath that's going to help to engage the diaphragm to move up and down underneath the rib cage to massage this major duct that's carrying the fluid. So, one way that I have learned or that helps to kind of tap into this type of breath is we'll place our hands to the belly like I'm doing in this picture. And then if you were one of those individuals that you felt everything sucking in, I want you just to take 3 sniffs, like you're sniffing something that smells really good. So go, and do you feel when you do that, the belly kind of puffs out, out, out? Try it again. So that activation is what you're going for. Now we'll take a slow inhale, but try to fill your hands with your belly. So inhale and then exhale. So we're imagining that the belly is a balloon, and as we inhale, it expands into the hands. And then as we exhale, everything relaxes, the balloon deflates. So, doing this type of breathing when you're in the car, waiting for an appointment, waiting to go to your treatment. Doing this type of breathing is super beneficial just for your mental health. When you elongate the exhale, that helps to tap into your rest and digest system, your parasympathetic, but it also helps to promote this massage and this vacuum like effect in the center of the body to move the fluid up toward to go back towards the heart. So that's the first component is the breath. Everyone feel okay with that? Doing good? The next is self manual lymph drainage. So each class I teach how to do this massage. So it's essentially a type of massage that's going to stimulate the lymph nodes. So again, those security guards who want to, maybe they're taking a little nap or got a little lazy. By doing this massage, we say, "Hey, it's time to work. Let's get going." So the massage, we target those major areas of lymph nodes. You can see in this image here, actually, one of my friends who I went to preschool with drew this up for me. So shout out to Maddie. But this is I think a nice kind of simplified version of where that fluid is going. So you can see that there's lymph nodes here at the sternal region, the breastbone, the armpit, the neck, the groin. So the body is split in half, and so basically, it's if you come down the center of the body and then across. And if you think of like a house, a roof of a house, when it rains, the fluid is either going to go to the left or to the right. So if you imagine kind of these areas, the body splits in half, so the fluid kind of goes towards the closest lymph node. So here in the breast and chest area, the upper body would go to the right armpit, the left would go to the left armpit, lower half of the right abdomen will go down to the groin, and vice versa. You can see this. The legs is all a one way flow up to the groin. Arms is all the one way flow up to the armpits. The lymphatic system is just a one way path because remember the blood The arteries bring the fluid out. Lymphatic system busboy picks it up and gives it back to the veins to come back to the heart. So the lymphatic system, we always encourage it to move towards the closest lymph nodes. So after we open up and wake up the lymph nodes, then we do something called medial lymph drainage massage, which helps to promote the lymph vessels to propel the fluid. So if you think about a line of cars from the fingertips all the way up to the lymph nodes in the armpit, we always start proximally, we always start closer to the body. So if you think of this line of cars coming all the way up, you have to move the cars up here first before you move the cars down here. Because if you try to push the cars at the hand to move, it's just going to get it jammed up here. So same thing here. We want to start at the chest so that we can alleviate this car back up here at this traffic here at the chest, so that when we move and do our yoga poses and stretches, there's free space for that fluid to enter. So I want to do this with you all now. So we're going to take our hands and place them at our chest. So you can do this one hand at a time or both hands, and whatever feels better in your anatomy right now, but try to get your hand nice and flat, and skin to skin contact is best. I'm going to go right over so that you can see my hands. But this is the first position. You're going to come here and you're going to stretch your skin in towards the neck. So this is called a stationary circle. So your hand is nice and flat. You're moving your hand in towards the neck, and then the body just kind of relaxes and then comes back. And honestly, there's not too many ways to mess this up. So even if you're like, what am I doing? That's okay. You're doing something. So this is the first position. And this basically is going to stimulate the lymph nodes above and below the collarbone, as well as this major drain. Next position, you can take the heels of the hands together like this and bring the hands to the sides of the neck. This is one. Or you can cross the hands and have the hands like this, whatever feels better for you. And you're going to draw that fluid down towards the collarbone. So you're going to do a little pumping back and then down. There's a lot of lymph nodes here at the neck that drain the face and the brain. You might even notice you might need to swallow a little bit, or maybe you feel it kind of moving. It's okay if you don't. So that's second position. Third position is hands at the shoulders. You can also do this one hand at a time too. And you're going to pump the skin of the shoulders as you move the elbows up and down. So this helps to stimulate all this central flow. And as you're moving the elbows up and down, this is going to help to stimulate those axillary or armpit lymph nodes. And then release your hands down. Close your eyes for a moment. Just notice. Take a breath in and out. So this is our warm up. So basically, this is getting everything moving and pumping here. Remember that all that fluid goes back to the bloodstream via ducts here. So if you think of like a tub of water, in order for that tub to drain, you have to open up the drain. So doing that massage essentially opens up this drain so that the fluid can start to move and pump. So just a few key components here just to keep in mind. So the skin stretching is really important because this is what helps to propel the fluid. So I always look down and see if you have a freckle, if you have a million freckles like me, look down at your arm, or maybe you have a mole or a scar, and then place your hand before or after that area. And then you can just slightly move the skin back and forth. So you can notice that it doesn't take much pressure to move the skin. So in your body, a majority of those little lymph vessels that are carrying the fluid are superficial to the skin. So they're very close to the skin. In the abdominal region, the pelvic, they're deeper. But as far as the neck, the chest, the arms, you really just need this kind of pumping, like skin stretching motion. So you always want to do skin to skin contact, because if you go over the clothes, you're just going to slide, right? You're not getting that traction. So I'll get a lot of questions. Should I do this while I put oil or lotion on? You can absolutely put lotion on. I highly recommend it, but do it afterwards, so that, because if you have the lotion, again, you're going to kind of slide up the skin. You're not going to get that traction. But then again, if lotion and massage, if you can only do them together, I'd rather you do them together, just because it's going to help to move. pressure, if you have lymphedema, which I know some of you said you did, that you can go a little bit deeper. So oftentimes area around like an elbow or a knee or an ankle gets a little bit thicker and more fibrotic, just protein rich fluid is just kind of stagnant in there. So then you can kind of go in and do a little bit more mobilization, kind of a little bit more kneading. And then time of day, anytime you can fit it in. I'd recommend you do this maybe 5 minutes before or after you shower, and you can do kind of this like warm up routine and then target whatever area that feels like it's swollen at that time. So our hands are the best tools for this, but there's also other tools that I thought I'd mention too. There's dry brushing. Some of you might have heard about that, or a little spiky ball or gua sha. So I'm going to teach you how to use your hands because that's free, but there's also many other options as well. So the third component of this type of yoga is muscle pump activation. So after we do that, we did the breath, we did the manual lymph drainage, then the yoga poses. So with the movement of our joints, again, think of those lymph nodes, they're all around the joints. Every time we roll our shoulders, we get the lymph nodes activating and moving here at the chest. So that helps to propel the fluid because the muscle contracts against the lymph vessels to propel it faster. And um, let me see. I think I had one more slide. Oh, maybe it's gone. It might be, yeah, it might be later, but some key poses that you can do that I'll show you today in class is to open and expand the heart as well as contract the core. Because again, if we can move those cars in the traffic jam here centrally, then we're able to move the fluid from the legs and the arms a lot quicker and easier. The last component, we're getting towards the end, so thank you all so much for paying attention and being here. But the last component of every class is some type of mindfulness exercise. So I always like to say, in order to heal, we must feel. So not so much physically feel, but mentally feel. So a lot of our class is based on listening, responding, and respecting your body, because I think that is where the real communication and the trust happens. So if you're able to kind of, oh, become aware of, ooh, it feels like a little bit of fluid is stuck in my belly, or a little bit of fluid is stuck in my leg, then you're able to listen and respond more effectively. So the takeaways, the four major components are our diaphragmatic breathing, our breath work, the self-manual lymph drainage, movement, muscle pump activation, and mindfulness. And oh yeah, here it is. So what are the best poses? So anything that you can lift your arms or legs up. When you do that, remembering that the lymph vessels are a one-way flow. So when you lift your arms up, that automatically opens up the vessels, the little valves on the lymph vessels to propel that fluid down. So that's why if your legs are swollen or your arms are swollen or hands, lifting them up and pumping, moving will really help. And then again, chest opening will help to stretch the skin to propel the central fluid moving quicker. And then any type of core contraction or hip openers or things that move the hips. So there's many benefits, and I am excited for you all just to try it today and see what you think yourself. But essentially, our whole purpose is to improve quality of life and improve this mind and body balance. So physically, strength, mobility, and stability, and mentally to improve mental clarity, relaxation, and wholeness. And then specifically for all of you, I looked at many articles and I read so many things about this specific type of lymphoma. And I found, and you all could tell me yourself much better than what I just read, but of the different type of symptoms. So I learned a lot about fatigue or lack of motion, and kind of energy levels and sleep were kind of the patterns that I saw were most affected. So this type of yoga and improving lymphatic health in general will help to improve the lymph flow, which helps to improve your circulation, which will help to boost your immunity. So think about that again. The individuals in the line at the security are just moving a lot more efficiently. Yoga in general eases physical and mental tension, will promote range of motion, strength, and flexibility. Oh, having awareness of where the pathways are and where that fluid moves really helps you to understand how to help yourself. If you have any hypersensitive areas, this can desensitize because you can start to build that trust and connection back with your body, your proprioception, your awareness of where your body is in space. If you have neuropathy or different sensitivity areas or lack of sensation areas, this will help to promote that fluid movement. Also, will help promote balance. I think above all, it helps to promote community, which I know you all have here, which is huge. And this also is just, like I said at the beginning, another tool to take back the control of your health and wellness and improve your lymphatic health. So, really quick, I'll just talk about three research studies and then we'll get into some of our yoga. So, the first one was a home based yoga program, which I thought was perfect because that's what all of you have been doing. And this was during active treatment, during the chemotherapy. So, they had 14 patients. The median age was 36, but it ranged from 13 to 65. And the non Hodgkin's lymphoma consisted about 64%. And they found that it improved the health related quality of life, improved their fatigue related scores, sleep, depression, and anxiety. The second research article that I found was talking about sleep and lymphoma, and 89% of the participants completed 2 to 3 yoga sessions, and so that's per week, and 58% completed at least 5 sessions. So I'm always thinking about this when I prescribe how much yoga we should be doing, and ideally every day is great, but it's good to see that even if you do 2 to 3 times a week, you're still going to benefit. And so the participants reported significantly lower sleep disturbances. They fell asleep faster, they had longer sleep durations, and they used less sleep medications, which is huge. I think it's fantastic. And then the last study was just talking about aerobic exercise in general and talking about physical functioning. And it said that the individuals improved their physical functioning throughout doing a cardiovascular fitness routine and helped individuals with lymphoma um, better manage their symptoms and what they were experiencing. So thank you so much for being here. And this is just some of my info and my QR code that leads to some of my links and resources. But I think now we'll start to flow if everyone's ready. So you can find a comfortable position. You can do this in a chair or the edge of the couch or the edge of your bed. But if you're in a chair, make sure it's a chair without arms because we're going to need a little bit of space. And when you arrive, just place your feet down onto the ground, the hands in the lap. And then feel free to close your eyes and just settle in. You can keep the eyes closed or you can just look down at the earth. And then as you're just arriving, start to notice your physical body. Notice where your body is in space with your eyes closed. Notice the points of contact you're making with the ground, with the chair. See if you can sit up a little bit taller, opening up through the chest. And then we're going to start breathing together. So as you inhale through the nose, we're going to lift the fingertips up. So stretch the fingertips up. And then as you exhale, we're going to drop the pinky finger, ring, middle, index, and thumb. So nice slow movement. We're going to inhale, lift the fingers up. You can keep the palms down on the lap. And then slow blow the air out through the mouth as you drop the fingers down. Just getting a little bit of mind and body activation. Inhale, lift the fingers. Nice and slow, lowering the fingers down. Take 3 more breath cycles like this. Inhale, lifting the fingers. Exhale, slow down the breath. Last one. Then we'll place our palms together. Then we're going to rub our hands together to create a little bit of warmth, create a little bit of friction. And then open up the hands like you're holding on to a little ball. And notice if you can feel the energy, maybe the vibration here. If you can't, give a little another rub here, create some heat and warmth. Feel that energy, and then take that energy wherever you need it. So maybe today it's your heart, your mind, maybe your hip, your knee. Place the hands, and we'll take a breath in here. Exhale, sigh it out. And then release the hands down. We can blink open our eyes and we'll begin. We'll start by inhale, reaching our arms up towards the sky. Exhale, slowly bring the hands down through heart center. If your shoulders are bothering you at all, you can come forward and then back into center if that feels better. Nice. Breathing in to lift and stretch up. Exhale, blow the air out as you come down. Beautiful. 3 more times. Inhale, lift. Exhale, lower. Inhale, reach and rise. Maybe wiggle the fingers at the top, send a little energy. And draw down. Nice. 1 more time. Big breath in, stretch up. And exhale down. Great. Now we'll begin our manual lymph drainage routine. So we're going to open up all the major lymph nodes in the body, but we're going to start with that warm-up routine that we did earlier. So take your hands to the chest, about 5 to 10 circles in this area. So you can close your eyes and breathe. You can always do this one hand at a time as well. Soften through the face, just stimulating the central drain here. And then glide your hands up to the neck. You can do heels of the hands together and pump the fluid down. Or you can keep them crossed and just draw the fluid down. About 5 to 10 strokes in each area is sufficient. And then we'll come to the shoulders. Stretch the skin of the shoulders into a little circular stretch as you pump the elbows. Soften through the eyes. Good. And then release the hands for a moment. Take a big breath in. Exhale, let it out. And then we'll start to wake up the large areas of lymph nodes. So we're going to start in our armpit. So you have about 20 to 40 lymph nodes here. So place your hand nice and flat. You're going to pump in towards the breast and chest. So you're going to have this kind of rhythmic kind of motion, just pumping, almost like you're kneading dough here. And then come to the other side. You can either keep the arm down or you can lift it up. This is really good if you have swelling in your arm or your breast or chest area or your armpit. Nice. And then we're going to come to the inner elbow. So you have lymph nodes in the inner elbow called your cubital fossa. You're going to place your hand flat and you're going to pump up towards the shoulder. Think of kind of like a little rainbow or a little C motion kind of pumping up, just stretching the skin. And then come to the other side. So with us waking up all these areas of lymph nodes, it helps to move the fluid faster, encourage more drainage to occur. And then we're going to take our fingers like we're playing the piano, and we're going to come right along here at the sternum, and we're just going to tap, tap, tap along here, just waking up the lymph nodes here. If you have a port or anything here, just avoid that. Just go lower. And then we'll take those piano fingers right below our rib cage, and we'll just start to gently massage here. If we can release any tension from the rib cage and the fascia through here, will help us to breathe a little deeper. And then relax the arms for a moment, give the arms a little bit of a rest. Take a breath in. Exhale, let it go. And then we'll take our left hand across to our right right below our rib cage, and we're just going to do 5 circles here. So this will really help if you're feeling any type of abdominal bloating or discomfort here. And then the other side, right hand comes across, and you're just making these circles. Good. And you can kind of explore a little bit here too. Notice what feels good. And then we'll take our thumbs to right around where the belly button, the navel is. And then almost like you're making a little triangle here so that the pinkies are right near the hip bones. You might need to sit back a little bit to give a little bit more room. And we're going to take the hands and you're going to pump towards the belly button here. So creating some circular pumps, massaging here at the hips. This is good to help the lower body drainage. Then you come to the sides of the hips, give a little massage here, maybe the back. And then if you're able to reach it, we'll go behind the knees. So cup your hands like this, and then you're going to kind of pump towards your hips. So hands underneath the knees. You can also cross it out and just kind of pump, pump, pump. Or if you have a step stool, that will help you too. So there's lymph nodes behind the knees here, popliteal fossa. And then we'll go to the other side. So this is good if you have any foot swelling or foot discomfort. And then come on back up. So you just did it. That's the awakening or the stimulating of all the major lymph nodes. And now we're going to engage in a full body practice to move the vessels, to move the fluid out. So we'll start by placing our feet down about hip distance apart, hands to the knees, and then inch your way forward. Sit up nice and tall, and we're going to take cat and cow. So inhale, draw your chin and your chest forward, broaden through the chest. And then as you exhale, slowly tuck the chin and round and curl and contract the low belly. Inhale as you pull yourself forward, nice. And then exhale as you round and contract. I'll move my body to the side so you can see what I'm doing. But as I'm inhaling, my pelvis is tilting back, my chest is opening. And then as I'm exhaling, I'm rounding. And if you'd like, you can reach your arms forward on this exhale to give a little bit more opening through the back. Let's take 3 more at your own pace. Breathing in, coming forward. And exhale as you round. You can reach the fingers forward, maybe wiggle them. Chest opening positions. Core contraction positions really help to move this fluid in the center of the body. Helps to support all our vital organs. And then we'll come back to center. And then we're going to slowly come over that right thigh, center, left thigh, and then back and around. So big circle. So this is really good if you are feeling constipated or if you have a lot of bloating or fluid stuck in your belly. This will help to move. Also really good for creating power. So this here is our solar plexus chakra, so our area of feeling in control or power. Nice. And then reverse the circle when you're ready. Going nice and slow, just moving to the rate of your breath. Just taking it easy. Nice job, everyone. Good. And then we'll come back up to center. Pause, take a breath. Exhale, let it out. And then we'll slowly drop the chin towards the chest, letting the back of the neck press. And then slowly lifting the gaze back up, and we'll drop right ear, right shoulder. Make sure to keep the shoulders relaxed. Try not to hike that right shoulder up. And then back to center, and then we'll drop left ear to left shoulder. Take a breath here. Then coming back to center, we'll draw our shoulders up towards our ears, back and down. Inhale, bring the shoulders up, 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 back and down. And if you'd like, you can swim the arms with this. So as the shoulders come up, bring the arms up, and as the shoulders come down. So imagine you're kind of swimming through maybe a beautiful lake or the ocean, or maybe if you have a pool. Swimming is also a really good way to improve lymphatic health because the water adds resistance. Nice job, everyone. And then coming back to center, hands to the thighs, relax your body for a moment. Then we're going to inhale, bring the arms out to the sides, thumbs pointing up. We're going to inhale, lift the arms up. And then exhale, spread the fingers, push the walls away as you draw the hands all the way down. Nice. Inhale, lift the arms up. Maybe you give a little clap, clap at the top, and then push the walls away. Awesome. 3 more. Inhale, lifting up. Give yourself a little clap, and then exhale, lower. Breathe in to lift. Little clap. Exhale. Last one. Breathe in, lift. Clap, clap. Exhale, lower. Nice. Hands to the thighs. We're going to slide the left hand down the leg as the right hand peels back. And we're going to take a little trunk rotation. So inhale as you come back to center. And then exhale, twist to the other side. If your spine does not like twisting, then you can just stay here and just kind of rock side to side. But if your spine is okay with this, maybe go a little bit deeper. Exhaling as you twist. It's really good to keep the spine mobile, also helping to move the fluid centrally. Take one more time to each side. And then we'll place our elbows by our sides, thumbs facing up. And then we're going to inhale, reach our arms forward. And then exhale, make tight fists as you draw the elbows into the side ribs. Good. Inhale, reach forward, spread the fingers, wiggle the fingers. Exhale, pull back. Squeeze the shoulder blades. Nice. Inhale, reach forward. Exhale. Really good one for your posture. Inhale, reach forward. Exhale. One more. Breathe in, reach. Exhale. And then palms facing up. We're going to find a little bit more chest and heart opening. We're going to inhale, keep the elbows glued in. We're going to open up the book. And then exhale, draw the pinkies just to kiss or touch. Inhale, opening up, squeezing the shoulder blades. Nice. Exhale, coming back in. Inhale to open. Exhale. One more time. And then soften through the hands. And then we'll lift the arms all the way up and imagine that a rope is coming from the sky. And we're going to reach one hand and then the other. Maybe we have some firefighters in the group. Reach up, feel the expansion in the side ribs. This helps to open up our intercostal muscles, helps us to breathe better. Notice how it feels. Reaching, and then soften down, relaxing the hands down. And then we're going to draw the right knee into the chest. If you can't quite grab it, you can always use a dish towel or a sweater to hold on to hold the thigh up like this. But from here, we're just going to find some circular movements. So you can hold on to the towel, or you can hold on to behind the leg, or interlace at the shin. So many options, but sit up nice and tall if you're here. This is really helpful to massage the inguinal and pelvic lymph nodes here. Nice. And then drop that down. And we'll lift the other leg, lifting the left leg again. So whatever position feels good, just finding some circular movements. It can go forward and back, whatever feels nourishing and comforting for you. And then dropping that leg back, we'll shift back to the right. Hands underneath the leg, the hamstring this time. Sit up nice and tall, and we're going to inhale, stretch that right leg forward, flex the toes back towards your face, and then point the toes and then slowly lower. Inhale, stretch that leg forward. It's okay if you want to keep a bend in the knee. Just go to whatever you can, and then slowly lower. Let's do it two more times. Inhale, stretch that leg out. Bring the toes back. This is also an abdominal exercise, and then slowly lower. You're probably like, yeah, I know, I feel it. Inhale, reach the leg forward. Last time. And then drop it down. Then before we transition to the other side, let's move our legs, widen the legs here. Toes pointed out, and we're just gonna glide down one side, and then inhale back to center and glide down the other. Noticing maybe the stretch in the hips, and the sides of the hips, and the side body. Awesome. And then bring the feet back together. We'll grab a hold of that left leg, interlace the hands underneath, or grab that towel. Hold on. And sit up nice and tall, engage the lower abdominals. And then inhale, stretch that leg forward, flex the toes back towards your face. And then exhale, point the toes and bend the knee. Nice. Three more times. Inhale, stretch out, bring the toes back. Exhale, point and lower. Sit up nice and tall. Good. Breathe in. And breathe out. Last one. Breathe in, stretch forward. And exhale. Lower down. Open up the legs again wide. And then from here, we're going to place our hands to the thighs. Inhale, sit up nice and tall. Then exhale, drop the left shoulder down. Inhale back to center, and then drop the right shoulder. One more time each side, back to center, drop it down. Inhale, center, exhale, drop. And then coming back to center, bring those feet in together. And then from here, inch your feet out a little bit further. And then we're going to inhale, reach the arms up. And as you do this, lift the heels up. And then as you exhale, drop the hands down, drop the heels down, and lift the toes up. So as you lift the arms, lift the heels coming onto the tippy toes. And then as you lower, drop the heels, drop the hands, and lift those toes. Good. Two more. Inhale, lift full body. Exhale, lower the heels, lower the arms, lift the toes. Good. Last one. You got this. Breathe in, lift, engage. And exhale, lower and drop. This time we're going to lift the left arm up and lift the right knee up. And then slowly exhale, lower. Inhale, right arm, left knee. And then slowly lower. So opposite. Sorry, I might have messed you up. Inhale, lifting the left arm, right knee. Exhale, dropping down. This helps to balance our hemispheres, getting both sides of the body to move. Good. One more time on each side. You got this. Breathe in, lift. Exhale, lower. Breathe in, lift. And exhale, lower. Nice job. Hands to the thighs. Take a breath for yourself. Let it out. And then we're going to open up the legs a little bit wider here. We're going to take one more full body movement. So take your hands like you're holding on to a beach ball, kind of a medium-sized beach ball. We're going to take that beach ball up overhead. And then exhale slowly. We're going to draw that beach ball down towards the right, towards the center, up the left, and up towards the sky. So breathe in here, big breath. Exhale, slowly lower. And then as you climb back up, you can breathe in. And as you exhale, you can lower. Breathe in to lift. Nice job. Exhale. And then when you come back up to the top, stretch up here. And then we're going to reverse down the left. Exhale. Inhale as you climb up the right. Exhale, lower. Breathe in, feel your whole body engaged. Inhale, lifting. Exhale, lowering, last one. And then as you lift all the way up, stay here. And then hands come down to heart center and pause. Notice the increase of blood flow, lymph flow, energy moving through you. Catch your breath. Connect with your heart. Breathe in and out. And then we'll release our hands down to the legs. Bring the feet back in. And then last little movement or exercise together, what we'll do is a little bit of a proprioception or awakening movement. So we're going to start to just gently tap along our legs, inside of the thighs, outside the knees, the shins, the feet, if you can touch it. But just give a little bit of tap, tap, tap. This is a really good body awareness exercise. It also helps with neuropathy, helps to improve blood flow, helps to give the brain and the mind something else to think about besides discomfort. Come to the lower belly, maybe come to the side of the hips, tap, tap, tap. The belly to the chest, down one arm, down the other, to the chest. Then my favorite part, come to the top of the head, tap, tap, tap along the face, the jaw, the chest, the shoulders, and then start to just ease the arms down and find a comfortable seat where you feel like you can start to relax just for a last few minutes here together. Maybe noticing the energy moving through you. Maybe it feels like a little bit of a glittery wake up for the body. But just place the palms into the lap, palms facing up if that feels good. Close your eyes and just let your body settle. And then give yourself permission to just be here for the next few minutes, to be here for your own self healing, healing from the inside out. Just allowing yourself to collect and enforce all the benefits of that movement, breath work, and lymph flow that you just accomplished. Notice how the breath is moving in and out. Take a slow breath in for a count of 3. And then a slow exhale for a count of 5. Breathe in for 3. And breathe out for 5. In your mind, you can say, I try my best. Exhale, and I release the rest. Inhale, I try my best. Exhale, and I release the rest. Feeling a wave of relaxation, comfort, and support come over you. Fill your body with hope, love, and joy. And then we'll start to wiggle our fingers and our toes. And then last time together, we'll inhale, reach our arms up towards the sky. Hands come down through heart center, thumbs connect with the heart space. Give this area a little massage here with your knuckles. And then we can bow to one another to share our gratitude for one another. Thank you all so much for practicing with me. Thank you.
Thank you so much, Babs. That was amazing. I feel so good. And I will just ask anybody who has any questions to type them into the chat. And I had some questions come through while you were doing your thing. So some questions come through. I had a private message come through. Can this type of yoga possibly help with insomnia?
Definitely. Yeah. And that was in one of the studies, just yoga alone. But I think that this lymph drainage massage too helps you to improve the flow and the lymphatics in the brain, in the neck and the chest area too. And I think insomnia can be caused by so many things, anxiety, it can be caused by pain, it can be a bunch of different things. So I think even doing that little warm up of just doing that gentle massage, like that warm up routine before you go to bed, would just help to kind of drain some of that tension here at the heart space and help you to kind of alleviate any tension in the mind. But whoever asked that, try it for the next week or so, and then let Anne and I know if it helps you.
Yeah, that was a good question. So someone is asking feedback on a professional lymph drainage massage. And I don't know, Renee, if you had anything more specific about, besides general feedback, whether that would be good for you. You can type it into the chat. If you feel comfortable being on camera, this is still being recorded. You can unmute. Um, but go ahead, Babs. I'll let you talk generically about that.
Sure, sure. It's wonderful. I think if you find and connect with a good practitioner, someone who is trained in lymphatic drainage massage, that might be a lymphedema therapist, that might be someone who is a massage therapist who has taken extensive courses. But if you do need a certification or a specialty in it, because it's very involved, and I think it can be super beneficial for a bunch of reasons. It can be for pain relief, pain reduction. It can be for relaxation. It can help move the fluid. But it depends on, yeah, who you go see. I would do your research beforehand. There's the Lymphedema Network has a resource or reference of a bunch of people, like a reference guide or whatever you want to call it. But I think it's wonderful. I do it on my patients daily, and I can see the fluid moving, and I can feel it moving, and I have feedback from my participants that is just so helpful in my patients. So I love it. I do it on myself daily, and I don't have lymphedema, but it just helps me to feel better and move the fluid. So yeah, I would highly encourage. And if you're in Boston, come see me.
Thank you so much. Yeah, I hope that answered your question, Renee. She's smiling.
Yep, thank you.
Got it. I guess any other questions, type them into the chat. We had a comment coming from Mary about where her lymphedema came from. It came from, I guess that was a nonspecific lung cancer, and that she had lymph node removed as a result. And then Waldenstrom's on top of that has created more issues. So Mary, I'm curious, because you do have lymphedema, whether this class helped you and how you feel, if you feel like answering that question, or if there's any specific question you want to ask Babs. Please note we still are recording, and if you're not cool with being on the camera, we can save this for our after portion.
It has, and I am seeing somebody in the cancer support community that is certified for lymphedema and massage. In fact, I saw her yesterday, and she has been great. It's been helping for the last year. And she says she can feel it, and it does make a huge difference for me. And after COVID, I had a lot of drainage into the pleural sac, and it's kind of sitting with the lymphedema, and she's moving the lymphedema, and now I'm getting stuff out. So it's been wonderful. Your recording was absolutely wonderful. Please put it on the IWMF for people that can't remember stuff, but it was wonderful. Thank you.
You're welcome. Glad that you're getting the care you need too.
Yeah.
So Amelia had typed in about some chronically painful lymph nodes in her neck. And she says she's going to continue with the practice to see if it will help with that. And she's being also reminded of some of Rami's, our Tai Chi teacher, some of the moves from Rami's class. So I don't know if you have anything additional you would add for chronically painful neck lymph nodes, Babs?
Yeah, I think low and slow. Like start off really slow. Do some gentle massage surrounding the area that might be painful. So say if the pain is right there, maybe do some more massage here, do a little bit here, maybe even like cupping the ear and just doing a little bit of mobilization there. Um, if it's swollen and painful, there's just some stagnant fluid, some stuff going on there. So maybe opening up and releasing the surrounding areas before you address that area might help just to improve the surrounding movement. But I would just do for a couple minutes, just do light skin stretching, see how you feel, and then you can kind of increase as you go. But I think it could help you, but I think listen to your body ultimately. Sorry that
Great.
you're dealing with that too.
That's great advice. And then, the order of things is very important, right? That we're not going to one area without doing other areas first. So with Catherine's question about feeling a swollen head, can she begin in the head? And I'm wondering, what your answer might be to that.
I would start at the chest, so the collarbones here. So you would start here, pumping kind of. So where the collarbones meet, it's this like sternal notch area. That's where all the fluid re-enters the bloodstream. So you can even palm kind of your hand flat there. And just begin some gentle skin stretching. But I would, no matter where the fluid's stuck in your body, you want to start at the chest. So start there, about 5 to 10 pumps, just saying, okay, let's wake up, let's get going. And then if it's along the neck, I would do kind of the shoulder area. I would move that out and then target the neck, do the other side, but always start here at the chest first.
Wonderful. Thank you. Anne has asked, is it helpful to massage your enlarged spleen? And I think this might be a little off our lymph topic, but I'm curious what you would say, Babs.
I'm not sure. I don't feel too comfortable or I think I would ask your medical team that one, because I think with an organ, it's you could massage kind of the skin, the tissue around it, but to actually specifically massage the spleen, I don't know if that would cause more irritation or less. But I think doing this gentle skin stretching massage, doing some deep breathing, doing some abdominal circles, that's all safe. But I wouldn't go and massage one certain area for a long time because any type of kind of deeper massage is going to increase blood flow, which there's more cells, there's more fluid entering, so it could cause an inflammatory response. That might be going too deep, anyways. But doing some kind of light massage, deep breathing, and some core contraction exercises, I think would be the best bet.
Wonderful. Cliff had another question about specific lymphatic massage for neuropathy in the legs and feet. And that is a topic we're always interested in. If there is a connection between moving the lymph fluid and an improvement in symptoms of peripheral neuropathy, I don't know about it, but I'm curious what you would have to say.
Yeah, I think that it's helpful, and neuropathy is such an umbrella term. So your neuropathy might be tingly, like sharp needle-like pain, or it could be just dull and numb. So I think depending on the spectrum or your symptoms, then I would treat it differently. So say you had this kind of like really sharp discomfort pain, I would again go easy, maybe just massage and gently kind of move the fluid because that's going to help promote lymph flow and blood flow and also help to promote awareness, your mind to your feet or your hands of like this is where your body is. But if it's really dull and numb and kind of like just not much awareness at all, then I might go in there and use some of those tools like a little soft spiky ball and do a little bit more kind of deeper or do a little bit more. So depends on kind of what your symptoms are, but I think again, big picture, doing this lymphatic drainage massage, this gentle massage to your whole body is going to improve the movement, the fluid, which will help improve the circulation in your body.
Awesome answer. Thank you so much. And you're also, by the way, getting a lot of nice comments. This was excellent. Learned a lot I can apply regularly. Thanks for this. I will do Qigong and this will complement each other. Lots of, people saying that they feel good after doing this, and that, we'll be really looking forward to doing more of this, weaving this into maybe some of our existing classes or coming to your classes. So what I'll do is I'll give a little close now, and we can turn the recording off. If there are any other questions people want to ask, we can do that then. But I just wanted to let you know the resources that are available. So not only will we have the slides from Babz's presentation. That's okay with you, right, Babz? I actually realized I didn't know if we communicated that back and forth. So obviously that's her property, but it's just for you to, be reminded of what we learned today. We'll have access to this recording and then a recording that will be just the practice portion. And those will be on the IWMF YouTube channel. But Babz also has her own YouTube channel with a lot of other videos that you might find helpful. Of course, knowing now we have the lens of looking through it with the angle of Waldenstrom's in mind. So that's something to keep in the back of your head if you're going to do those other videos. And I'll share all of that information in our follow-up email that'll be coming out in the next couple days. So we're going to edit the video and get all those resources put together. But is there anything else you want to add, Babz, before we stop our recording?
Sure, yeah. Thank you so much for trusting me to come on and sharing this with all of you. And it's so nice to meet all of you. And the videos on my YouTube channel, I think I have over 600 now. They're all very similar to this. I have a lot of chair videos. I have a lot of floor. So they're very adaptable and very similar to this. So they're very appropriate for all of you. And if you're ever like, I need a video for this, just email me and I'll find it for you. If you ever like to join me live, I teach Zoom classes as well. But yeah, thank you all for welcoming me into this community.
Thank you so much, Babz. Great job today, and we will hope to see you soon.